mHealth Fairview's Surgical Site Infection Prevention Bundle. An infection in the wound after surgery is called a surgical site infection. About 2 to 5% of all patients get an SSI and is the number one cause of readmission after surgery. There are many things our team is doing to prevent an SSI, and we want you to partner with us. Here are some key words at key times for our patients. You can provide the patient with the rationale for all the SSI prevention measures by using these examples.
Hi Mariah, I'm Georgine. I'm one of the registered nurses. I'm going to get you ready for surgery. Can you please state your name, what you're having done, and who your surgeon is?
Yeah, my name is Mariah Renquist. I'm having a left total knee replacement today with Dr. Nice.
Okay, great. We're going to do several things today to help prevent surgical site infection, and I'll kind of walk you through this.
Okay, thank you.
Mariah, did you do any special showers prior to coming today?
Yes, I did one last night and one this morning.
Did you happen to use all of the soap?
Yes, I used all
very
of
good.
it.
Okay, wonderful.
Pre-operative showering. Surgery patients are asked to take a shower the evening before and the morning of surgery with a soap containing chlorhexidine. The timing is important. 2 showers spaced apart helps build a protective layer of CHG on the skin while helping to reduce the amount of bacteria or microbiome on the skin. If the patient did not complete both showers, a full body cleanse with CHG wipes need to be completed.
So we're going to clip any hair that you have in the incisional area, and we're going to cleanse the area with those CHG wipes just to reduce any bacteria and prevent surgical site infection.
Okay, thank you.
Pre-procedural hair clipping. Hair on skin can also cause an infection if allowed to get inside the surgical wound. Remove the hair near the incision site with the clippers instead of a razor because a razor may create microscopic cuts on the surface of the skin where microbiome can enter and cause an infection.
So Mariah, we want to maintain a normal body temperature to reduce risk of infection as well as reduce bleeding, shivering, and pain after surgery. So we're going to plug this blower into your gown that we placed, and you can adjust the temperature with this knob here. It's important to leave this on and not turn it off.
Okay, I will do this.
Normothermia. Maintaining normal body temperature is called normothermia. When a patient is under general anesthesia, the body's ability to maintain normothermia is altered. It is not the same as sleeping in your bed at home. Pre-warming helps the body maintain normothermia throughout surgery. Remember to place your warming blanket on 30 to 60 minutes prior to OR time to help maintain a normal body temperature during the procedure. Also, don't forget to take a pre-op temperature for baseline. Make sure to turn the warming blanket back on when in PACU.
Your nose is a place where germs live. We don't want those germs to spread to your incision. We'll be swabbing your nose to help prevent infection. Each nostril will be cleansed twice, and we just ask that you do not blow your nose for an hour afterwards.
Okay.
Nasal decolonization. Using Nosin nasal sanitizer or 5% povidone iodine nasal antiseptic prep before surgery reduces nasal bacteria, including Staphylococcus aureus and MRSA, by 99.5% for 24 hours.
High blood sugar levels have been associated with an increased risk of infection and poor wound healing. Since you are an admit, we'll be monitoring your blood sugar before and during surgery and keep it within a safe range to help promote wound healing.
Glycemic control. Point-of-care testing is done on day of surgery for patients being admitted and for patients that have diabetes. Refer to the glycemic management workflow found in the system protocol.
I'm going to administer some antibiotics. Administering antibiotics prior to performing surgery helps decrease the risk of postoperative infections.
Antibiotics. A single dose of antibiotics given 20 minutes before surgery can reduce the rate of SSIs to 0.6%. The goal of antibiotic timing is to achieve maximum tissue concentration. Antibiotics should be started less than or equal to 60 minutes prior to incision for short infusing antibiotics, and they should be complete 20 minutes prior to incision. Cefazolin is the best antibiotic for surgical prophylaxis for most procedures. Long infusing antibiotics, if used, should be started to assure infusion completion at least 20 minutes prior to incision. If it is longer than 60 minutes prior, redose antibiotic according to policy. These are just some of the ways we are working to prevent surgical site infections. Thank you for partnering with us to provide an optimal care experience for our patients today.